and am I working with the Jessica Korpics? Yeah. So
yeah,
I
went to Rush too. I graduated in 2017, so I don't think like you were. When did you start?
I had just started after you graduated, so this is coming up in my 4th year. Yeah.
Oh, that's awesome.
Oh, very cool.
Yeah.
And you are at Cook County?
Mm-hmm. Yeah, I'm at the health department.
Oh, okay.
But then I do a peds clinic just once a week at County at Stroger.
Okay.
Yeah.
Very cool.
Yeah.
I credit County with saving my life.
Oh, really?
Yeah, I have really severe asthma as a kid.
Oh,
and
my gosh.
Can bother me sometimes. And so after going to the ER 3 times in one day, 2 times at my home hospital, they sent me home. And my grandmother said, no, don't take her there. Go to Cook County. And that's where my mom took me when I was admitted to the ICU. Wow. Yeah, it was pretty scary, but I remember it. So, yeah.
Yeah. Oh, wow. Yeah, I feel like a lot of people have. All right. Hi, everyone. All right. Hopefully everyone can hear me. All right. So I guess we'll get started. All right. So it's great. So I'm Dr. Jacqueline Korpics. I am a pediatrician and I'm also a preventive medicine and public health physician. I work at Cook County Health in the Cook County Department of Public Health, and currently I'm serving as the medical director for the COVID-19 response. So I've been involved in the response since the beginning. In January 2020, when we had our first cases in Illinois, and I've been, active in contact tracing, alternative housing, and now vaccination. And we're honored to have Dr. Kerri Lockhart, who's a native of Chicago. She's a board certified pediatrician and fellow of the American Academy of Pediatrics, like myself. She has the leading diversity, equity, and inclusion certifications through Northwestern University. And then she is currently working at Rush University Medical Center as a pediatrician. So thanks for being here with us, Dr. Lockhart.
Thank you for having me. Really glad to be here.
All right, so we will get started. Just one moment. Okay, so I just want to welcome everyone. This is the Cook County Department of Public Health Asks the Doctor series. Mm-hmm. So we're happy for everyone who's joined tonight, or maybe you're watching the recording, but we're looking forward to answering all your COVID-19 and vaccine-related questions. And tonight, we're actually focusing on family and childhood vaccination issues, but all questions are welcome. And we ask that you share this event on Facebook right now. We found that residents who share with their family and friends help to drive participation and attendance. And we ask that you follow us on our social media channels, and we'll post those links in the chat. We ask that if you have a question to just leave it in our chat section. We'll be monitoring that. And then we are recording this event so you can rewatch it later or refer a friend or family member to the recording. So we know you have lots of questions about the virus, variants, vaccines, so let's get started. All right, so let's see if we have any questions in the chat. Okay.
Doesn't look like yet, not yet.
Dr. Lockhart, is there anything that you want to start us off with?
Yeah.
Any comments?
Yeah, just a little bit, about what my experience has been, which is a little, I won't say limited, but when this all first started, unfortunately, I was sick with COVID. I was probably one of the early people in the city to become sick. March of 2020, I was away from the office for several weeks, very sick. I didn't have to be in the hospital, but I have a history of asthma. So we know there's some conditions that are going to predispose you to potentially being more ill. And so when things were really we were in the throes of figuring things out, I was out sick. And so it took me about 5 weeks to really recover it. Feel like I was back to normal. Just trouble, all of it, trouble breathing and everything. So when I came back, what I noticed over those months, I do strictly outpatient medicine. And so what I noticed was that our numbers kind of followed the trend of what was going on in the city or around the country. So when numbers were going up, we'd see more pediatric patients testing positive. We know in general, we don't see a lot of positive COVID cases in pediatrics, but we see them. And occasionally children get, fairly sick. So we were, seeing kiddos coming in with cold-like symptoms, congestion, cough. Occasionally there was some runny nose, shortness of breath kind of thing, fevers and that, that thing. And we were testing, initially we were doing some rapid testing. Now we're doing the PCR in the nose. As we, have moved into, this kind of second wave, I guess it's second, third, fourth wave of with the Delta variant, I think, it looks like things are still out about how significantly this will affect children. For now, it still appears to be the same, that kids are not becoming infected with COVID as much as adults are. But we're still watching because the information could come back showing differently. I think what's most important tonight is to really get a clear understanding about what the recommendations will be about masking as kids are all going back to school. Yesterday, the CDC really put out some important information, and so that's changing day to day, which is how things can happen in a pandemic. And so I hope that we can shed some light on that and give parents really good information so they feel comfortable when they're sending their little ones back to school.
Great, thank you. And so we're getting a lot of questions in the chat, which is great. So the first question I see, is there any current ETA on vaccines for children under 11 or any federal guidance? So we know that Pfizer is approved for 12 plus. And so Dr. Lockhart, do you want to take that?
Sure. So it's been pushed back a little bit, and the FDA has asked for more children to be enrolled in the trials. And this is just to be safe. With the first group of children, the 12 and older group, 12 to 18, they had enough information and data with that group of during that study to make sure that it was safe. And for this, next group, they just want to be sure. So initially there was talk about early fall, and I think that's being pushed back to late fall, early winter. But it's a moving target, because if you get plenty of people, kiddos enrolled in that trial, and you get the data that you need, it could come sooner. So unfortunately, it's hard to give a hard and fast timeline about when that might come. We hope sooner, because the sooner we can get more children vaccinated, the closer we can get to moving past this pandemic. But it's hard to give a definitive, because we have to get enough children enrolled in the trials, and the researchers have to be able to look and make sure that they know that it's safe. And so that's really what's happening now. This was a more recent recommendation to have more children enrolled in the trial.
Yeah, that's great. I know we're all anxiously awaiting that. I've heard the same. I've read the same, that we're hoping by the end of the year to have that approval for all the way down to 6 months. So we're all kind of anxiously awaiting that. So I'm trying to prepare parents and kids in clinic. Hopefully this will be coming out soon, and then trying to encourage families to plan to get it for their children.
Yeah.
I see Patricia is asking, can you still get COVID-19? And maybe Dr. Lockhart, if you want to answer that, both for if you were vaccinated or not.
Okay, absolutely. So I'll start with if you're not vaccinated. So absolutely, you can get COVID-19 if you haven't been vaccinated. And potentially, if you've had COVID-19 and you've been infected, there can be a potential for reinfection. So we know that for sure. If you've not had the vaccine, you are at risk, highly at risk. And seeing, what COVID has done for, to people, the long-term complications, even when some people recover, we know that the vaccine is the safest way to protect yourself, to protect your family, children over 12 and adults. So without that vaccine, you're highly at risk. Wearing the mask is going to be important and it can protect you. But, having a multi-layered approach to protect yourself and really do everything you can to prevent yourself from being infected is what it's going to take. So that means getting a vaccine, wearing your mask, socially distancing where you can in crowded places, avoiding them if you can. So absolutely, if you're not vaccinated. If you are vaccinated, your chances of getting infected with COVID-19 are extremely low. Having said that, there's still ongoing data coming in that shows that there is a slight increased risk of getting COVID-19, the Delta variant, which is the more predominant variant that's circulating now, if you have the vaccine. So many of my patients who are unvaccinated, when we talk about it, their question is, then why would I get the vaccine if you could still get COVID-19? There's a really compelling reason to get the vaccine still. People who are vaccinated by far are less likely to end up in the hospital and to die from COVID-19. So you may get it, but you are not likely to get very sick. You may have cold symptoms. Some people are asymptomatic, which means you have no symptoms. You don't know you have it, which presents another concern, which we can get to later. But yes, with both, you could potentially get COVID-19, but your risk absolutely by far higher without the vaccine. And when you have the vaccine, you're just simply more protected and unlikely to have any really dangerous outcomes. The most recent data, so for the past 2 weeks, it's been 99.5% of the people in the hospital, but I think it bumped down just a little bit to like 98% of the hospitalized people are people who are unvaccinated. So the way I describe that to families is if you have 200 people who are in the hospital with COVID-19, only one of those people will be an unvaccinated person. 199 will be people who are unvaccinated. So you are much more protected and just safer and healthier if you get the vaccine.
Great, thank you. Yeah, just very well said. Like you had mentioned, very rare that you'll get COVID if you've had the vaccine. The Pfizer vaccine and other vaccines, we still think they're about 80 or 88% effective, even against the Delta variant. So we're seeing this, almost 100% efficacy of vaccines.
Yeah.
And so, but then even if you do get sick, you do get infected, a lot of people don't even know because they never show any symptoms, or if they do, it's just very mild cold symptoms, very short-lived, maybe a day or two, not like going to the hospital, like Dr. Lockhart said. We think lower risk of, long COVID. We think we're hoping and still studying that you are also at a lower risk of spreading it, even if you do get infected after the vaccine. So a lot of good reasons to get the vaccine for sure. I see a question. So with the Delta variant, is there any discussion on phase rollback? So there hasn't to date, but we not on the phases, but we, like Dr. Lockhart mentioned, the CDC did yesterday come out and say that we should go back to masking if we're at substantial or high risk as a community. Right now, Cook County is not in that substantial or high category. We certainly won't be surprised if we get there. So the recommendation is, definitely wear your mask indoors. We know that your risk is much higher if you're indoors versus outdoors. And then they also changed their guidance for schools to recommend universal masking. So any parents on the calls or school staff on the call, you may remember initially the CDC said, make sure that anyone unvaccinated is masked. Now we're changing that to universal masking, which, supports the American Academy of Pediatrics. And if you're just joining the call, we're two pediatricians, members of the AAP. So we're excited to see the CDC supporting that. I don't know if you want to mention anything else, Dr. Lockhart.
Yeah, I was very happy to see the AAP come out with a really strong and clear statement last week. And then the CDC yesterday being really clear about what should happen in schools. Keeping, I think as pediatricians, we were very much thinking about the fact that we have lots of patients who are not eligible for vaccines, patients who potentially are immunocompromised, who we just don't know what their immune response to the vaccine might be. But certainly that population who's not eligible yet. And so having children in school with that, going on, but also, there's this question about the Delta variant potentially being, if you have the vaccine, and you are asymptomatic and you have gotten COVID, that the risk of spreading might be higher with the Delta variant. In the past, we've been pretty excited that if you get COVID and you're vaccinated, you likely don't spread it, but there's some question about if that may be more likely. So you've got a lot of reasons that it would just be risky to have children in schools, close proximity, and putting them at risk for COVID-19. Not to mention, you mentioned my DE&I work, I think about the equity piece of this. There are just going to be so many schools that don't have the resources to track who's vaccinated and who's not, to really monitor that. And so children are children. We know, how it works in groups. And so if one person is unvaccinated and all their friends are, and they're all not wearing masks, I'm not really convinced that, that 9 or 10-year-old who's supposed to be wearing a mask will. And so there's so many reasons for that recommendation, and I'm really happy to see that.
Great. So next question, are there any contraindications to getting the vaccine as long as you're old enough? And how long after getting COVID do you recommend waiting to get the vaccine?
So the first part you'll have to correct me on, but I don't, besides having an allergic reaction to the components in the vaccine, and for the Johnson & Johnson vaccine, there are some specific recommendations if you've had certain types of clotting issues. Other than that, there are hardly any contraindications to the vaccine. And that's because many of the conditions that we find are just going to increase your risk for bad outcomes with COVID-19. So there are hardly any contraindications. I've had people ask about pregnancy. Pregnancy actually increases your risk for having a more severe outcome with COVID-19. So we recommend it in pregnancy. We recommend it if you're breastfeeding. We recommend it if you have high blood pressure, diabetes, heart problems, asthma, all of the common conditions and even some of the uncommon ones. You're pretty safe. And if there's something you're unsure about, I really encourage you to check with your doctor or a specialist that you're following, because they will have information about if there's particular contraindication. But in general, I don't know of many. And the second, go ahead.
Oh, go ahead.
Well,
No,
I
yeah,
don't
I
remember
was
the
just
second
gonna,
question. So you'll have to tell me again.
yeah, no, I just want to second that, no contraindications unless you're allergic to the vaccine itself. And like Dr. Lockhart mentioned, all these health problems just make us want you to get the vaccine more because we're more worried about long-term effects of COVID and, having severe COVID or needing to be hospitalized.
Yeah.
The second question was, how long after getting COVID should you wait to get a vaccine?
So yeah, I've looked at this, and so theoretically, so you could certainly get it when you feel better, but what we typically tell folks to do is wait 90 days, because around in that time period is when some of the research has shown that your antibodies from COVID-19 infection start to wane. Having said that, the data indicates that the antibodies that you get from being infected with COVID-19 are not as robust, like they're not as strong as when you get antibodies, that protection from the vaccine. But really, once you're feeling better, you can go right and get your COVID-19 vaccine. And the 90 days would really be if we were very sick, maybe in the hospital potentially. But mostly the folks I've been seeing, once they're feeling better, they come and get their COVID-19 vaccine. So there's no real recommendation to wait.
Yeah, we get this question all the time in the health department. And like Dr. Lockhart said, unless you got really sick and had to get a certain medication for COVID, you don't have to wait. As soon as you're out of your isolation period, because we don't want you getting anyone sick at the vaccine clinic, then you're ready to get it. Our next question is there any guidance for children that have weaker immune systems?
Guidance in terms of maybe wearing mask or vaccines, or?
That's a good question. I guess we can kind of touch on all of it. Definitely. So like we were talking, it's not a contraindication to get the vaccine as long as they're of age. And actually makes us more, want that children with weaker immune systems to get the vaccine more. Definitely want them to be wearing masks, but now that we have universal masking in schools. Anything else that you want to add, Dr. Lockhart?
Yeah, so I think there's kind of this risk, benefit. I have not looked to see if it's still there, but I know towards the end of the school year on the CDC website, I think there was a risk assessment that you could do. It was a questionnaire. It was the CDC or the IDPH, I can't remember. But there was a questionnaire you could go through, and it would really help you assess the risk that your child would have in terms of going back to school. I mean, we know that in general, kids are going to do better if they can be in school. Last year was a really tough year for most of our kiddos in clinic, coming in, and kids who were doing really well struggled last year. And so the ideal is to have them in school, but of course we want that to be done safely. So I think if you have a child who cannot be vaccinated, so they're under 12, so they're not eligible yet, and there's a really, big concern for their safety in terms of, potential of getting COVID-19, then you have to really weigh those risks and benefits. I know that the CDC has really made a strong recommendation, the AAP, but school districts can decide, to do what they want. The expectation, I think, is that they will follow the CDC guidelines and the AAP guidelines, so that they're in line with what the science is saying. And so, if schools are doing that and doing the measures that have been recommended, I think, and it's safe, then I think wearing a mask and having your kiddo back in school. If we didn't answer what you were thinking, though, post more in the chat, and we'll readdress.
Okay, great. Thank you.
Yeah, that was it.
All right. So we have another question. What if vaccines will not become safe for children 12 and under. So I'm assuming that means, the results of the
Oh.
study. Are children going to have to stay in masks forever?
I would hope not. I mean, I can't say no. Forever seems, pretty lengthy. But I could see, as long as they're circulating COVID-19 at any significant level, we would ask for children to be masked. And that's, we understand, nobody loves wearing the mask all day. It's not, the most optimal thing to be doing, but we would not ask if it were not for their health and safety. And so if for some reason the studies show that, I don't expect that they will. It appears that they're looking at one main component, that there's been a slight increased risk of something called myocarditis in the 12 and older. And it's my understanding that was not seen in the trials. I don't think it was seen during trials. And the risk is elevated, but not significant enough that the risk of that outweighs the benefits of preventing COVID-19. And myocarditis is where there's some myocarditis and something called pericarditis, either infection of the heart or infection of the sac that surrounds the heart. And so we really give parents guidance about watching for the symptoms of that so that we identify it early and we treat it. And the few teenagers who've gotten that have done really well. And so I think that they want to really make sure if that they're seeing that increase in the younger children before they move forward. So I don't anticipate that it won't be approved. I think they just want to do their due diligence, and we are very happy they are.
Yeah. Yeah, I heard you say the words risk benefit a lot, and that's something that I, end up saying a lot myself. And I think as pediatricians, we're used to talking about risk a lot. And as physicians, we're used to assessing, risk versus benefit all the time. Are we going to give medicine? Are we not going to get medicines? Right. Because we know all medicines have the side effects. And I know as pediatricians, we, are the physicians who really try to hold back giving anything to kids, like including antibiotics, medicines, unless they actually need it and the benefit does outweigh the risk. And I try to remember that, people aren't used to, not all people are used to thinking about risk every day. And how do I lower my risk? What increases my risk? And so, really, we're just talking about decreasing your risk as much as possible. That being said, there's definitely people who have different tolerance level for risk. So I'm sure from your own family and friends, there was people that, were still kind of going about their business during lockdown, but were careful about wearing a mask. Then there was people who just didn't want to leave their homes at all. So I think as physicians and pediatricians, public health professionals, we're trying to help people understand the risk and benefit the way that we understand it based on the science. And so, we're always happy to have those conversations with parents and with children. I've had, a lot of parents, I always ask them if they got the shot, especially if their child is too young to get the COVID vaccine, because they're really the ones that can protect the child. Yeah. And some parents have said, I'm really scared to get the shot. And then I usually respond, well, I'm really scared if you don't get the shot. Yeah. So we kind of had this conversation, risk, benefit, risk of the vaccine, but then we're talking risk of COVID, we're just seeing that risk. And now that we're seeing long-term effects, on the heart, lungs, we're even seeing some things with the brain, people who, and then I don't know, Dr. Lockhart and I are both only in the outpatient clinic, but I'm hearing from physicians who are in the hospital that are meeting with a lot of patients who are getting hospitalized after getting COVID, didn't get the vaccine, so they got pretty sick. and like expressing, regret that they didn't get the vaccine, or asking, can I get the vaccine now?
No, yeah.
Will that help me? And it's really heartbreaking as physicians, especially as pediatricians and public health professionals, where we're really trying to be that, person that you can ask the information to and trust. And a lot of doctors are just really, really, really sad when they've encountered that.
Yeah.
All right. So I see the next question is masking still up to school boards to decide?
Theoretically, no, but there is no statewide mandate. So without a statewide mandate, schools can decide. And so the information provided, did remind school districts that they should be mindful that, any insurance coverage and that sort of thing may not be willing to cover any type of, outcomes from not following the mandates of CDC. And so I would think that would be, considered, by many school districts who, I know there were some already who had made a decision to make masking optional. And so with the new recommendations, I have been hearing that schools, just already are revisiting their policies, given the new recommendation. So technically they don't have to do what the CDC has said. It's been highly recommended. And there are lots of reasons, again, to consider that, because it could really potentially become problematic if there is an outbreak at the school, and how they manage that, from a liability standpoint. So my hope is that everyone will just follow the science, the recommendations of science, and mask.
Yeah. And definitely parents, school staff, pediatricians, we can all be advocates to get schools to do the right thing and follow the guidance. But we get that question a lot also at the health department.
Yeah.
We can't enforce it, but we're trying to, support schools the best we can, answer all their questions. We have a call every Friday with the schools in our jurisdiction, walking them through exactly how they can be the safest during this time, while still recognizing, like I think Dr. Lockhart mentioned, we all recognize the importance of in-person learning. I see the question, have school districts been given guidance around better filtration systems for ventilation? And I don't know if Tom or some, they have, so it's in the CDC guidance, and has been, and was in the old version. And schools kind of have like a mapped out recommendations for how to decrease risk. So we're talking about, decreasing your risk as much as possible. And I liked, somebody made the analogy of, you're in a car, being in a car is risky, but you wear a seatbelt, you have airbags, you might have some fancy system in your car that, makes it even safer to drive. And so schools, we're trying to give them all of that. So it's not just masking, where in the guidance, ventilation is very important. So, so we've talked, like in the guidance, we'll talk about filters. We've talked about like keeping windows open. Some schools have even considered doing some of their learning, outside if possible. I know that's tricky, obviously, in Chicago in the winter time. But yeah, so masking is not the only thing. There's a layered prevention, like strategies of prevention that we work with schools to get them to follow to decrease their risk as much as possible. And ventilation is a huge one.
I should add, CPS does have they've already decided Chicago Public Schools are doing required masks. So for anyone who's in CPS, if you were wondering, they're requiring masks for everyone in school.
Yeah, that was great. They made that recommendation even before the CDC.
Yeah, before the CDC. Yeah, ahead of the game.
All right. So another question for you, Dr. Lockhart. So if there will always be those who cannot get the vaccine, how will mask wearing ever end?
I don't know. I'll be honest with you. If COVID-19 is circulating again, I mean, we had I guess nationwide, there's 68% of people vaccinated right now. And up until recently, we were doing, some places we're doing okay. And so what I anticipate is eventually people will be vaccinated, because I think the variants, the way I talk about viruses to young people in my clinic is viruses will try to put on camouflage. Once we figure out how to fight them, they put on camouflage to try to trick us, trick our immune system, so we don't recognize them as well and we can't fight them as quickly. And so that's what these variants are. And so they will keep coming. And I think some people, for different reasons, will be compelled to be vaccinated because they will have learned enough. They will have had enough time. They will talk to people they trust, which I think is probably most people. They just need to have trusted messengers who really spend time and explain things in a way that they understand, give them the space to think about it in a non-judgmental way. And so I think, I don't think it's Pollyanna to think that eventually most people will be vaccinated. There's a big difference between people who are anti-vax and people who are just vaccine hesitant. And I do believe that most people are vaccine hesitant. Dr. Rhea Boyd is a pediatrician out of California, and I follow a lot of her work. And she, really highlights this point that most people are just hesitant. And so I think hesitancy we can work on. We just have to get people the right information. I think, it's important to have information and then access to the vaccine at that same time. You can't, give people all the information and then they have to wait a week to go and get the vaccine. And so I just can't anticipate that we'll be doing this forever. Now, us in the healthcare field, we'll probably be wearing masks for another 10 years, but I think there will come a time where, I don't know when that'll be, but I think there will come a time when the public will not have to mask and kids won't have to mask in schools. But as long as there is a pandemic and this virus is, we know how deadly it is. As long as that's around, we will have to do this.
Yeah, I just want to add, this stresses the point that not just for COVID, but for other illnesses, we get vaccinated not just for ourselves, but to protect those around us, especially those who can't get vaccinated. So, children with cancer, a lot of those children can't get vaccines. So they really rely on other kids getting their vaccines and their parents getting their vaccines. So this is just something that we're used to, getting vaccines, not to protect just yourself, but to protect those around you who aren't able to get certain vaccinations. But as we said earlier in the call, fortunately, there's really not many contraindications to the COVID-19 vaccine. But it's still important to, we still have these age requirements until we get more information and more data. So, we encourage, I encourage all my parents in clinics to get the vaccine, if for no other reason, to protect their own children. Yeah. Dr. Lockhart, I see a lot of comments in here about remote learning versus in-person learning. And I know this has been a hot topic. I'm just curious, your thoughts about, this has actually been such a hot topic from the very beginning of COVID-19. And so I'm curious, your thoughts about that issue.
Should it be an option? It looks like, so I struggle with this a little bit, I'll be honest with you. So we've been getting some requests. I think there's a form that parents can have completed if they are opting in for remote learning. My understanding, it's not going to be an option for many schools this year. And if you want that option, there's a type of online learning, but you have to have a certain health condition, and then there are stipulations for that. And if you don't meet the criteria, really based on that, you can't do remote learning. My struggle, I think, is really that if a school really has the means and the ability to really, do all of the recommendations that are laid out by the CDC and, the newest ones, and, some of the old things that have come that are still on there, I think then we can trust, science, that kiddos are going to be safe. But if we're talking about a school that just really doesn't have the ability to do that, they cannot change the ventilation system and have not been able to do that. You can't keep students even 3 feet away, which is the recommendation in schools. I think I struggle with telling parents who are afraid that, no, you have to send your kiddo to school, not with the science. The science is the science. I trust that. But I know I understand parents' fear. I got a request to fill out, someone with asthma, and it was very mild. And I was really it was the first one. And so we kind of discussed it as a group to figure out how we would approach these. But I can imagine, as a parent, being very afraid for your child and not having the choice. And that choice is not the same. There are going to be some school districts where you absolutely have the choice, where you have the means to homeschool your child. And so I think that's where it gets hard for me. If you're afraid and you don't want to send your child to school, what are your options? But I also know that it is very challenging for teachers to have to manage both. So I don't think there are any good solutions to either. I know that most kids did better in school. I know that many teachers were afraid to be back in school, and there were some teachers who were, became ill. So I wish I had a more definitive answer for the person who asked on that. I think I understand both sides, and I don't think it's a cut and dry or black and white answer. Afraid parents, I completely support and understand that. I know that kids do better in school. I just want this pandemic to be gone so that, parents don't have to be afraid to send their child who has mild asthma to school and worry if they, get COVID, that they will get very sick. And teachers don't have to worry about if they have a class that's they're overwhelmed with students, that they might get sick. And I wish that there were better options for everybody to choose so that they could feel comfortable. And there aren't. And I don't have a good answer for that.
Yeah, it's definitely tricky. I remember at the very beginning of the pandemic, this was all over the news, very upset teachers, very upset parents. But I do feel, and you bring up all great points, risk versus benefit. We know, especially certain children, especially children with special needs, or just different learning styles. Between, kids in my family, some of them loved remote learning, and the other ones really struggled, couldn't pay attention, basically. Yeah. So, it's definitely tricky, but I do feel like we're in such a better place. I know everything feels scary right now with the Delta variant, but we are in such a better place than we were prior. We have all of our school staff vaccinated, or hopefully all of our school staff vaccinated. We encourage schools, to get their staff to 100%. We have some of our kids vaccinated, and we definitely want schools to try to convince families to get kids who can be vaccinated, get them vaccinated. Schools have always been our way of getting kids vaccinated. If it wasn't for schools, requiring certain vaccines, we wouldn't have the great vaccination rates that we do to get rid of like a lot of terrible diseases like measles and other things. So vaccination has made it so much better. We also have a lot more science about how to prevent things. So at the beginning, we didn't have great data on masking or ventilation or, cleaning surfaces or things like that. Now, we've been studying this for a long time now. And so we have science to support what schools should be doing. We have health departments, and pediatricians to help guide schools and families to make this safer. So I definitely feel like we're in a lot better place. It's definitely, again, still scary, but in such a better place than we were at the beginning.
Yeah. And I think if schools implement all those things, I think will be good. I think my question is, do all the schools have the resources to do that? And when I look at the vaccine rates around the city, there's some pockets that are really low. And so if those are low, then I worry about the school vaccination rates being low. And so I did see, some recommendations about schools having access to vaccinations in the school. That would be amazing if schools had, vaccination clinics right there on site so that people could get information and then get vaccinated there. So doing all the things that we know work to keep risk low, to mitigate risk, then absolutely. I'm thinking more of places who can't do those things. And I imagine everybody can do some. So
yeah, and the state and nationally working with schools that are lower resource. So for example, there's tests. So we're promoting screening, and schools that are lower resources, they're being given those tests for free. So we're trying to support those schools that don't have the resources. And then contact tracing will be, is ongoing. It's still happening. We pay special attention to schools. So all of those things we have on our side. Okay, so I have another question. What are the long-term effects of COVID itself? Are there any known long-term effects of the vaccine?
So the long-term effects of COVID, I mean, just this week, there was a new study that came out showing long-term cognitive effects of COVID, even in people who completely recovered. I think that one was pretty shocking. Not the results, but just shocking to the system a little bit to hear that you completely recover from COVID and, months later, people are still having some changes in their cognition. And so these are people who, certainly who are hospitalized, but even people who were homebound with COVID and required medical intervention is what this study showed. Some people have a long-term pulmonary, so lung issues, from requiring oxygen to just simply never recovering to their baseline where they were before infection, before they had COVID. I'm blanking on all heart long-term heart issues as well. Those are the three big ones that, which are the three major ones: heart, lungs, and your brain. I don't know of long-term complications with the vaccine. Certainly, if you have had the thrombosis, which, I think since making the recommendations, that has decreased significantly with Johnson & Johnson's. There can be complications as a result of that, clot in the brain, but no long-term complications as of yet. I don't know, Dr. Korpics, if you have more information about that, then we can add.
Yeah, no, none. Agree with what you said. Yeah, no known long-term effects of the vaccine. We any like adverse effects that people have from the vaccine should ideally get reported by that person and also by their doctor to the CDC. So the CDC has been monitoring that closely. That's how we knew about blood clots. That's how we knew about myocarditis. But we've been happy to see that those have been super rare. And then for kids, especially rare. And then, even the very small amount of kids who've gotten myocarditis have recovered well. And so, again, going risk versus benefit, definitely seeing a lot more long-term effects from COVID itself. COVID itself can cause blood clots at a higher rate than, we're seeing any vaccine do. So, yeah. All right. So I'll move on to the next question. I see Jen. I know that I see Jen in the chat did post that her son has cancer. So she's advocating really hard for universal masking. And yes, as we talked about earlier, if not for yourself, for your kid or for other people's kids, to get the vaccine. Okay, I see another question. My cousin's child has speech apraxia and sensory issues. Last year, she missed a lot of her therapies and socializing with peers. This year is starting to look the same, as masking was a problem for her and Shield was not allowed in their district. Why are those kids being forgotten in the system?
Yeah, so the recommendations are clear that if there is a kiddo for developmental reasons, disability, or really designated reasons that they can't wear a mask, that they should be allowed not to wear a mask, because ideally everyone else in the class can wear a mask. The teacher is wearing a mask, and so if there's some document, it sounds like there's a documented disability that prevents your child from wearing a mask, and so that was clearly highlighted in the recommendations by the CDC. So I would check into that, because the remote learning, that was one of the really big things that I noticed. Many of my patients with that needed speech and occupational and physical therapy, some of those were able to be done remote, but many of them were not. And so our kids with disabilities and developmental delays really missed out on a whole year of support. And being back in school will help with those. But we certainly don't want to have another year for your kiddo being in school and not being able to get the support because, the masking. So there are, few exceptions, but, there are exceptions to wearing the mask. And it sounds like that would be one of them, if that's really, preventing her from, learning and doing moving, her mouth and speaking. So that I would think that would qualify. Chat with your pediatrician and see if there's a documentation that you need with the school. That's what I would recommend. Since I don't know all the details, I can't speak for sure. But if there's I know that the recommendation says that if there's a disability that prevents a child from wearing the mask, they should not be forced to wear a mask. Right? Am I correct about that?
Yes. Yeah. There's definitely a caveat in the CDC guidance, recognizing that children with disabilities may not, or special needs may not be able to wear a mask. But that being said, most children totally safe wearing a mask. So I don't know if you want to comment, because I know there's been some concern about, can they breathe and things like that. I don't know if you want to comment on that.
Yeah. Kids, I find, wear masks better than most adults. There's some kiddos who just aren't used to it. And you can tell those, parents will say, we don't leave the house really. We have not done anything during this pandemic. And those kiddos are not used to it. But, I've been in the operating room as a medical student with doctors who are wearing masks for 14 hours. They absolutely can breathe. It can be like a learning curve a little bit. So I have been recommending for some parents who's, 5-year-olds who are going to be going to school for the first time. And have been remote this whole past year, to start working on practicing with the mask at home and just do it a little bit at a time and increase it over time so that they can start to get used to it. But absolutely, I'm trying to think, how old was she? She's 2 or 3. This little cutie pie was wearing a mask for the whole visit, didn't touch it, didn't move it. And, they go out for walks a lot. So she was quite used to wearing the mask. So it takes them, getting them used to it. But their kids they're amazing. They will really just kind of roll with it. So you practice with them and they can wear them pretty well.
Yeah, I think one of the things that most pediatricians love about kids is they're just so resilient. Like they can take on anything, and they'll adjust. And I find myself, seeing kids reminding their parents to put their mask on, or, grabbing their mask before they leave the house. Yeah, it's been, and then also I just want to stress too, when we were talking about kids with special needs, I've seen a lot of my parents with kids with special needs, jump on the vaccine as soon as it was approved, to get their child that vaccine so they can start feeling comfortable with, going to their therapies, going back to school. And you can just see, the kids, we're talking a lot about physical health, but, mental health too. I can just see, kids just so much happier to be socializing and, back to doing the things that they used to be doing. So definitely another reason to, jump on the vaccine and decrease their risk as much as possible, especially if you're having any difficulty with them wearing a mask.
Yeah. Yep.
So I don't see any other questions in the chat. Dr. Lockhart, is there anything else that you want to say, or any comments? We do have another question. How is updated information from the medical community being disseminated to the educators in districts? Is there a formal process in place or just the normal public channels? I can answer this one. So at the health department, we take on that responsibility of disseminating that information to educators and districts. As I mentioned in the beginning of the call, every Friday we have a call with schools, school staff, school administrators, superintendents, walking them through any updates, walking them through any confusing parts of guidance. And then in addition to that, once we have any updated guidance, it goes straight to the schools. So schools are pretty much, one of our top people on our list that we're sending information to, and now preparing to go back to school. We've been focusing on schools specifically and giving guidance specific to that. I don't know, Dr. Lockhart, if there's anything else you want to add.
I know that pretty early on, there was like a call from the Illinois chapter of the AAP for pediatricians to, Illinois to offer guidance, for COVID recommendations and things like that to schools. And so we have I'm on an email where there's just a few of us, and, we'll talk about different things. We talked about the recommendations and that kind of thing. And so that's the extent of, I think, our involvement, so to speak. And, if someone calls for our for our thoughts, we send that to the Illinois chapter of the AAP. And I suspect they probably then give that to either Cook County Department of Public Health or Illinois Department of Public Health. So that, there's certainly official channels, I think was the question they were, asking. So CCPD and everybody, all the departments of public health are on top of it.
Yeah, so thank you, Dr. Lockhart. So we are slowly running out of time, just a couple minutes left. Really, really great questions. I'm very grateful to have everyone participate today. And then, hopefully you'll share the video with friends and family, colleagues, or people at your school. And yeah, just very, very grateful to have everyone on this call. Really, really good questions. Super thankful to have Dr. Lockhart here. We really appreciate all of the information you gave, answering all these questions. So hopefully we can have you back sometime soon.
Sure. Thank you for having me, and thank you for all the work you do.
All right. Thank you so much, everyone. We'll see you next time on Ask the Doctor. Good night. Have a good night.
Good night.